Imagine a threat so prevalent that 1 in every 8 men will confront it in their lifetime. Prostate cancer stands as the second most common type among men in the United States, shadowed only by skin cancer yet leading to a profound impact on countless lives each year. As we delve into this pressing issue, it's crucial to recognize the early signs of prostate cancer, which often whispers its warnings quietly, making early detection both a challenge and a critical advantage. Today, we're going to explore these subtle early warnings, the ones that, if heeded in time, can dramatically shift outcomes from despair to hope. We'll uncover why catching these signs early can mean the difference between a straightforward treatment path and a far more complex battle. Join us as we navigate through the crucial information that every man should know, empowering ourselves and our loved ones with the knowledge essential for early intervention. Before we continue, make sure to like this video and subscribe to the channel. By doing so, you'll stay informed on essential health topics like this one and help spread awareness to others who may need it most. Now, let's dive into the signs you need to watch for and the steps that could save a life. It begins with a small gland, no larger than a walnut, hidden deep in the male anatomy. This unassuming part of the body, the prostate, plays a vital role in reproduction, producing fluid that nourishes and protects sperm. Yet for all its importance, it's often overlooked, until something goes wrong. Prostate cancer arises when cells in the prostate begin to grow uncontrollably. It's a disease that doesn't announce itself loudly. In its early stages, it often presents no symptoms at all. This silence is deceptive, as the numbers paint a stark reality. In the United States, prostate cancer is the second most common cancer among men, trailing only behind skin cancer. According to recent data, nearly 300,000 men receive a prostate cancer diagnosis each year. It's not just a statistical figure, it's an alarm bell ringing for vigilance. Why is early detection so crucial? Because, when caught early, prostate cancer can often be treated successfully. The survival rate for localized cases, the kind that hasn't spread beyond the prostate, is extraordinarily high. More than 99% of men diagnosed at this stage will live at least 5 years, often much longer. This success hinges on one critical factor: recognizing the signs early enough to take action. Symptoms, if they appear at all, can be subtle and easy to dismiss: changes in urination patterns, mild discomfort, or occasional pain. However, these minor inconveniences might be the first whispers of something more serious. Regular screenings, including PSA tests and digital rectal exams, can catch the disease long before symptoms set in. For men at higher risk, particularly those with a family history of prostate cancer or certain genetic markers, screening can begin earlier, providing a crucial window of opportunity. Understanding prostate cancer starts with acknowledging its quiet beginnings. It's a disease that, in many cases, offers no early warning. Yet this very silence makes awareness and proactive health management all the more important. By recognizing the significance of early detection, men can take the first step toward protecting themselves and their loved ones from a disease that, when caught in time, is often highly treatable. Imagine waking up in the middle of the night, not once, but several times, with an overwhelming need to use the restroom. At first, it feels like an inconvenience, nothing more than an interruption to a good night's sleep. But then, it becomes a pattern, a nightly occurrence. This is often how it begins. What seems minor, what feels like a nuisance, could be the body's first way of sounding an alarm. For many men, this is where the story of prostate cancer quietly starts. Urinary changes are among the earliest signs, but they often go ignored. A man might notice he's going to the bathroom more frequently, both during the day and at night. The urgency becomes harder to control, leaving him searching for the nearest restroom wherever he goes. And then there's the hesitation, the difficulty in starting the flow of urine. It feels as though the body resists, even though the need is pressing. The stream might be weaker than before, stopping and starting unpredictably. What's worse, even after he's done, it might feel like the bladder isn't entirely empty. These small, almost unnoticeable changes can hint at a larger issue, one that needs immediate attention. But it doesn't stop there. As time goes on, the discomfort grows. Pain begins to settle in areas that once felt strong and reliable. The lower back, for instance, might start to ache, a deep, persistent discomfort that stretches into the hips. Sitting down becomes unbearable, as if something beneath the surface is pressing inward. The pelvis, once an afterthought in daily life, becomes a constant reminder that something isn't right. This pain isn't random. It's a signal, a warning that the disease might be advancing and pressing against nearby nerves and tissues. And then there are the signs that truly cannot be ignored. For some men, the discomfort becomes most noticeable during moments of intimacy. Ejaculation, which should bring relief, instead brings pain, sharp and unexpected. It's not just physical discomfort but a jarring moment of realization that something deeper is wrong. Blood in the urine or semen may follow, a stark and visible sign that can no longer be brushed aside as coincidence. These symptoms are rare but significant, often pointing to a more advanced stage of the disease. Unexplained weight loss, once a cause for celebration, now feels hollow. Pounds begin to drop off without effort, and it's not the result of a diet or exercise routine. Fatigue sets in, an exhaustion so profound that even the simplest tasks feel monumental. It's not the kind of tiredness cured by a good night's sleep. This is the body struggling, fighting against something unseen but relentless. Each of these signs, when taken alone, might seem harmless or connected to something minor. Frequent urination. That could be a sign of aging. A weak stream. Maybe it's just dehydration. Lower back pain. It's easy to blame that on long hours at a desk or heavy lifting. But when these symptoms begin to pile up, when they form a pattern that's hard to ignore, it's time to listen. It's time to act. Prostate cancer doesn't often announce itself loudly in its early stages. Its signals are subtle, its warnings quiet. But these signs, no matter how minor they might feel, are a call to action. The body is speaking, and it's up to each man to pay attention. Regular screenings, like PSA tests and digital rectal exams, can identify the disease long before these symptoms even appear. But when they do, they must not be ignored. Time matters. Recognizing these changes early could mean the difference between a simple treatment plan and a far more difficult journey. Men are often reluctant to discuss their health, especially when it involves something as personal as urinary or sexual changes. There's hesitation, perhaps even embarrassment. But this silence can be costly. Prostate cancer thrives in the absence of action, growing steadily while it's ignored. By the time symptoms become severe, the disease may have already advanced. That's why awareness is so critical. These signs are not just nuisances, they are the body's way of asking for help. If there's pain, discomfort, or changes that feel out of the ordinary, don't wait. Consult a healthcare provider. The earlier these signs are investigated, the better the chances of catching prostate cancer while it's still confined to the prostate. And when it's caught early, the survival rates are extraordinarily high. Over 99% of men diagnosed at this stage will live 5 years or more, often with minimal disruption to their lives. So, pay attention. Be vigilant. The signs are there, often small and easy to dismiss, but they are never meaningless. They are the difference between hope and regret, between action and consequence. Listen to your body, it knows more than you think. It's easy to take good health for granted, to assume that the body will continue to function as it always has. Yet beneath the surface, changes can begin slowly, quietly, and without warning. These changes may not demand immediate attention, but they carry consequences that could shape the future. Prostate cancer is one such challenge, a disease that thrives on delay, on hesitation. But here's the truth, it doesn't have to. Proactive steps can save lives, and it begins with knowledge. Screening is the first and most critical line of defense. For men at average risk, the conversation should begin at age 50. This isn't just a suggestion, it's a vital step. A discussion with a trusted healthcare provider about prostate-specific antigen, PSA, tests and digital rectal exams can offer clarity. For those at higher risk, including African American men or those with a family history of prostate cancer, that conversation should begin earlier, at age 45. And for men with multiple close relatives diagnosed with prostate cancer before age 65, the guideline suggests starting as early as age 40. These aren't arbitrary numbers. They are based on decades of research and have the power to identify problems long before symptoms appear. Screening isn't about fear, it's about taking control. It's about giving men the tools to protect themselves and their loved ones. The PSA test, though simple, can provide invaluable insights. Combined with a digital rectal exam, these screenings form a comprehensive approach to early detection. Yet, these steps are only the beginning. The choices made every day can influence the risk of developing prostate cancer. Lifestyle adjustments aren't just about living longer, they're about living better. A balanced diet, rich in fruits, vegetables, and whole grains, provides the nutrients the body needs to stay resilient. Fatty fish, like salmon and mackerel, are excellent sources of omega-3 fatty acids, which may contribute to overall prostate health. On the other hand, reducing red and processed meats can limit exposure to potentially harmful compounds that may increase cancer risk. Exercise, too, plays a critical role. It's not about grueling hours at the gym but incorporating movement into daily life. Walking, cycling, swimming, or even gardening can improve circulation, reduce inflammation, and maintain a healthy weight. Obesity has been linked to a higher risk of aggressive prostate cancer, and maintaining a healthy weight can be a powerful preventative measure. But prevention isn't just physical, it's mental. Stress can weaken the body's defenses, making it more susceptible to illness. Practices like yoga, meditation, or even deep breathing exercises can help maintain mental clarity and reduce anxiety. Prostate cancer prevention isn't just about what's on the plate or the scale, it's about cultivating an environment where the body can thrive. And when questions arise, when the uncertainty feels overwhelming, support is never far away. Reputable organizations like the American Cancer Society and the Prostate Cancer Foundation provide a wealth of resources. Their websites offer guidance, from understanding risk factors to finding local screening centers. Support groups, both in person and online, connect men with others who have walked this path, offering encouragement and practical advice. No man should feel alone in this journey. It's also essential to stay informed. Regular visits to a healthcare provider aren't just for when something feels wrong, they're a chance to stay ahead. Asking the right questions, understanding personal risks, and staying up to date with medical advancements can make all the difference. Prostate cancer thrives in silence, but proactive steps can break that silence. Screening, lifestyle adjustments, and the support of trusted organizations form a powerful defense. These aren't just recommendations, they are actions that can save lives. It's never too early to start, and it's never too late to take charge. The choice is clear: act now, because health is not just a gift, it's a responsibility. It all begins with paying attention, listening to what the body tries to tell us in whispers before it's too late. We've uncovered the critical early signs of prostate cancer, from changes in urinary habits to discomfort in the back or hips, from unexpected fatigue to visible signs like blood in urine or semen. These are not inconveniences to brush aside, they are warnings, urging action before it's too late. The message is clear: early detection saves lives. By staying proactive, seeking regular screenings, and addressing even the smallest concerns with a healthcare provider, men can take control of their health. Screening doesn't just offer answers, it offers time, options, and the chance to intervene when outcomes are most promising. This is a call to act, not tomorrow, not next week, but now. Share this knowledge with the people you care about. Start conversations that may feel uncomfortable but are vital. Together, we can spread awareness, encourage action, and protect lives. Thank you for watching. If you found this information valuable, don't keep it to yourself. Like this video, subscribe to the channel, and share it with others who may need it. Your support helps ensure more people have access to life-saving information. And always remember, when it comes to your health, don't hesitate. Consult a medical professional for guidance, because your life and well-being are worth every effort.